Okay. Hi.
Hi.
How are you, my dear?
I'm doing well.
Such a pleasure to see you again, and I'm so delighted that, after, I don't know, 2 months that we've been talking about getting together,
I know.
we finally do.
I know.
This is Ify Whitfill.
We hate Gmail.
Yeah, we did. We had Gmail. Ify Whitfill, who has a wonderful marketing agency of her own, and I'm going to let you talk about that just a minute. And we have Lynn Hundley, who is with us from Norton, who is also on the board of the Kentuckiana Stroke Association.
Yes, ma'am.
And an expert on stroke. So, if you would not mind sharing with us your credentials, which are quite impressive, tell me what guarantees you to be an expert on stroke.
Where should I start?
Can you take it from TAR that you're an expert on stroke?
I think so. They tell me that.
Just tell me however it is that you are considered an expert. What have you done in your life?
In my life, well, I've been a nurse for 30 years.
That's helpful.
That's helpful.
Yep.
And I started working in stroke in about 2005-ish.
Wow.
When I worked at another hospital where we led them to stroke certification.
Wow.
So really started the focus on stroke. I've been a neuro nurse for longer than that, but the focus on stroke started then.
Okay.
So I'm certified in the neurosciences. And I'm also board certified as an advanced neurovascular practitioner. And I've led the stroke program at Norton Healthcare for the last almost 7 years.
Oh, that's amazing.
So I keep those centers certified, and we achieved comprehensive stroke certification at our Brownsboro campus originally in 2015.
So what does that imply for someone who is coming in with a stroke? It means that that's where they're going to get the best care?
It is, and actually the literature will tell you that care is better at certified centers.
Quicker responders or
yes,
whatever?
Yes, ma'am. Everybody's ready. It's like a well-oiled machine. When you hit the ED, they're ready to descend upon you and give you the best care.
What's the ED?
Emergency department.
Oh, boy.
Used to be ER. Now it's ED. That's
now
a
it's
new
a department.
thing.
I see.
Emergency department.
Okay, good. I've been watching Grey's Anatomy just for the last few nights to get ready for this, so I'm very, very well prepared. So, Ify.
Yes, ma'am.
We met when we were up at 8 Up, and I think it was the Louisville Magazine launch party.
Yes.
And we were chatting about all kinds of fun things, including the fact that you have a fabulous new agency, which I want you to tell me about.
I do.
And then after she tells you that, I'll tell you why we have the stroke expert here.
Okay, yeah, I have a marketing agency. It's new here in Louisville. I started in about December.
Yeah.
Growing pretty slowly. I have a family, 3 little kids and a husband.
Holy smoke.
Yeah, I'm just trying to balance that. But I have a few clients already, which I'm proud of.
Yes.
It's hard getting started sometimes. So.
How old are the 3 kids?
Gosh, 8, 7, and 5. I always have to stop and think. I'm like, they keep changing ages, right?
Can you believe she's got 8, 7, and 5-year-olds?
No.
She looks
not
like she's
at
in
all.
her 20s.
Yeah.
Oh, thank you.
You're more than welcome. So
yeah.
you've got the 3 kids, you've got the husband, you've got the job.
Yes.
What do you do for fun?
When's that happen? No, I'm just kidding. We go to the pool a lot in the summertime.
Right under here.
Wintertime. I guess, I don't know, I like to craft. Like, so I make stuff. Yeah, I like to build things. So I go to Ace a lot.
Oh, how funny.
And I don't know, I like to work a lot.
You do
when
like
I
to work a
yeah,
lot, don't you?
Yeah.
So the reason that we are talking about stroke today is because, and the entire tenor of this interview changed 2 days ago when Ify told me
that I had a stroke 2 years ago.
That's absolutely unbelievable to me. How old
Yeah, a
are
lot
you?
of people say that. I'm 35.
Is
So I
it-
was 33 at the time.
Is it unusual to have someone in their early 30s have a stroke, Lynn?
20 years ago maybe, but now we see people that are younger and younger, in their 20s even. The causes are generally different in someone that's your age. However, yes, those numbers unfortunately are growing.
What do you attribute that to?
Some of it, the most common cause in someone your age is generally a dissection from some kind of an injury. So that's where, usually it's from a stretch injury or something like that, where the layers of the arteries, there's like 3 layers, the layers kind of peel apart, and it just kind of sticks out into the lumen or the tube, and slows down the blood flow. And then the slower blood flow can cause clots, and that can perpetuate into a stroke. So in younger people, that's really the most common cause.
When she said stretch injury, I'm thinking immediately yoga.
Right, I was thinking stretching.
I just stretched something and then I had a stroke. And that's a
Motor
terrifying
vehicle
thought.
Motor vehicle accidents, roller coasters, sports-related injuries, yes.
Roller coasters.
Yes, ma'am, where your head's jerking around.
Shaking.
Oh my
vessels
gosh,
in the
I
front or the
would've
back
never-
of your neck. So in
never
younger
thought
people,
about
that tends
that.
to be the most common cause. The next thing in a younger person would be a disorder that you might have inherited that caused your blood to be more prone to clot.
Yeah.
Oh, wow.
So in younger people, we tend to look for those kinds of things.
That's just amazing. So what kind of stroke I mean, are there different types of strokes?
Yes, ma'am.
And what kind of stroke did you have, Ify? Do you know?
Cryptogenic. I have a PFO.
Okay.
So I don't know. Did I give the correct answer there?
You did.
Okay.
Cryptogenic is mystic. We don't know what caused your stroke.
Yeah.
Okay, about 30% of strokes are found to be cryptogenic, and in a young person, that's often what the answer is. If you have a PFO or a patent foramen ovale, which is a hole.
Wait a minute. What is that?
A patent foramen ovale, which is a
Patent
hole.
foramen ovale.
Mhm. It's a hole between the top two chambers of your heart that's supposed to close when you're born. Now, about 25% of the population are walking around with that and don't even know they have it.
You did? Oh
I didn't
my
know I
God,
had it,
that's
yeah.
You
amazing.
don't know you have it until something happens,
Right.
such as a stroke. The only way the circulation will cross would be that hole. In order to be sure that's what caused your stroke, you would have had to have a blood clot somewhere travel through that hole and to get up to your brain.
Right.
Normally, those blood clots would get stopped in your lungs, like a pulmonary embolism from a
right.
blood clot in your leg. It's kind of like it would filter out in your lungs. But if you have that hole where the circulation can cross over to the left side of your heart, then it can go up to your brain and cause a stroke. If they didn't find a source of a clot, like a blood clot in your leg or some other reason that there would have been a clot there, they can't be 100% sure that that patent foramen ovale is the cause, because 25% of the people walk around with them and never have a problem. And we don't ever know they have it.
So
It's really
25%
small.
of people could have exactly what happened to Ify happen to them and not even know it. Did you suffer symptoms immediately? Did you know that you'd had a stroke?
Yes.
What did
it was
you feel
very
like?
obvious. So immediately, well, I was slurring my speech. First, I think I lost control of my hand. I wasn't really thinking very well, I don't think, because when I lost control of my hand, I thought, I'll just use my other hand. Because I was trying to pick something up, and I looked and I thought, I just put that in the locker. Why is it still there? And then, so anyway, I threw it in there, and then I turned and started talking to my daughter, and she said, "Mommy, you're talking funny." And that's when all of a sudden I was like, I'm having a stroke. And I don't know where that came
Wow.
from, but I think maybe my brain was like, your arm's not working, and now you're slurring. And I've always heard slurred speech with
Yes,
stroke.
yes.
So then I walked over to a bench, and I lost my left side by then. I collapsed on the bench, and
Where were you?
luckily there was a nurse there.
Where were
I
you?
was at, what's it called? The pool over in Crescent Hill. I can't think of what it's called.
Mary
right
T.
now.
Maher.
Mary T. Maher, yes.
Oh my God.
And I was very lucky. There happened to be a swim meet that day, and so there was an ambulance there.
Oh,
So-
very
And where
lucky.
did they take you, Ify?
U of L Hospital.
They're also a comprehensive stroke center.
So that was a good decision
Absolutely.
to go
They
there.
actually asked me where I wanted to go, and I was thinking I'm passed out half the time, and they're asking me. I was like, U of L? I don't know.
Oh my God. So
but
when
yeah.
you got to U of L, so let's talk about the protocol, and then we'll ask Ify about her experience.
Sure.
What is the protocol for someone who is experiencing a stroke and they know, she said she knew she was having one. There are all these things all over the internet that tell you to ask questions and do this and do that and do the other thing. I don't believe any of that's true. It's dial 911.
Yes,
Right?
that's what you should do, dial 911.
What do we do then?
Okay, you experience the most common symptoms of stroke. Have you heard
Yes.
FAST?
Yes.
Face, arm, speech, time to call 911.
Oh, wow.
Okay, so she had the speech problem, you had the arm problem. So 80% of strokes will present like that. We can talk about the other 20% later if you'd like. But so you need to call 911. That's the only answer.
Yes.
People take a nap. Did it hurt? Did you have pain anywhere?
No, I don't think so.
So they're not in a big hurry to go to they think, I'll go lay down, I'll rest, it'll go away, or I'll be better later, I'm just tired, I got done working out.
And you could
I've
probably
heard 'em
die
all.
in that time,
Absolutely,
right?
Wow.
you could, absolutely. Or be devastated for life. I mean,
Yes.
I'm sure you would have been devastated for life had they not treated your stroke promptly.
Right.
But absolutely, you've got to call 911 and take me to a certified stroke center. The closest one to you that can provide either the medication that busts the clot, or for more severe strokes, we would tend to want you to go to a comprehensive center where they can actually go in and remove the clot.
So years ago, when my father was aging, and it was before just a few years before he passed away, and he really had remarkable health. He was in the hospital for an angioplasty because he had experienced symptoms of a heart attack. But in the ICU, they said he started a stroke, and a nurse who was watching him gave him a shot of TPA, which is what the clot busting drug, I
Yes,
guess,
ma'am.
still is, and it stopped it immediately. So he actually didn't have the stroke. She was so observant. I mean, they were literally like one-on-one in this particular place. And so I guess what I'm curious about is in the time frame that Ify felt like she was having the stroke, they were at a swim meet, there was an ambulance there, they got her into the ambulance, they took her to the hospital. then did they administer this
Yes,
clot-busting drug?
After some x-rays, because I was so young, they didn't know what was happening.
Right.
They might have thought it was drug-related or what's the other?
Yeah, I'm drug-related. I'm at the
Bell's
pool with
palsy.
a kid at a
Yeah.
swim meet, and I'm
Bell's
taking
palsy.
crack.
Yeah.
No.
Bell's palsy is limited to your face, though,
Yeah.
so that wouldn't have
Right.
accounted for the rest of your symptoms.
I
Okay,
think they
so-
didn't know, and then they didn't know if it was a hemorrhagic stroke,
Yes.
so they
Oh,
had to
boy.
make sure.
Yes. So
And
once you
it's probably
arrive,
about 30, 45 minutes before I actually got the drug.
which is
how much-
actually good.
Is that good?
Yes. The goal, overall national goal, is at least within 60 minutes, and the new push is 45 minutes. Every minute, 1.9 million brain cells die. For every hour, your brain ages about 4 years.
Well, I
How
can
many
feel it.
millions of brain cells do we
You
have?
have billions, but
Billions.
in about 12 minutes, you've lost the size of a pea.
Holy smoke.
And the older I get, the more that bothers me.
Yeah, I can
Yeah.
understand that.
Because your brain atrophies as you get older. So I like to teach people that TPA, or clot buster medicine, which is actually the only FDA approved drug for stroke still since 1996.
Yes.
Okay, I call it Drano for the brain, because strokes are a problem with your plumbing. Okay, you either have a clog or you have a leak.
Right.
I'll be
So they
darned.
had to do the scan of her head to ensure there wasn't bleeding or a leak in one of her vessels, because it would produce the same symptoms.
Makes sense. I have to say goodbye to Russell because he looks like he's leaving us. Thank you, Russell. Come here and shake my hand. It was so nice to meet you. Thanks for here. Come here. You haven't been on camera yet. Come on over
man
here.
behind the camera.
Get right behind us and smile. Yeah, there we go. This is Russell Goodwin, ladies and gentlemen. He's wonderful. Thank you for setting us up. And we'll just keep chatting and we'll leave whenever we get done. Okay. Thanks.
Voice is cool.
Isn't he cool?
Yeah.
I keep telling him he needs to be in
Got
radio.
that very white voice.
I know he does. That's very white. He does. So you and we go back and forth on Take It From Tara. You know, you've got some serious conversation, and you have some funny stuff like me asking Barry and Ferdinand to loosen their ties because it was a little stilted at first. I wanted to kind of get them into the flow of things because it's hard to do an hour. You know, especially when you're talking about something that's not, you know, like animals and children parading in front of
Right.
you. So this is serious conversation about stroke because, as we were just talking about before we ended the first interview, stroke disables millions of people a year, and is fifth? Did you say fifth leading?
It is
cause
now
of
the
death?
fifth leading cause of death. Since
Yeah.
I've been in this world, it's gone from 3 to 5.
Wow.
So that speaks a lot to the work we've done in
So
stroke.
you're doing better
You know,
at
the certified
keeping
centers,
them.
the rapid treatments, that the better rehab kinds of things. It has dropped from being the leading cause of disability to a leading cause of disability,
Okay,
and
that's
just
good.
within the last year in the statistics update.
So tell me how you felt when you got to the hospital and they gave you the TPA. Did you immediately feel relief?
I don't remember, honestly.
Kinda
when
out
they
of it?
gave me the drug, I was in and out of consciousness the whole time. I can tell you this, I was still working the whole time too, with my phone right there. But I look back at my texts and they were all messed up. So
isn't
even
that
though I
interesting?
thought that I could do it, I look back and the words didn't make sense, the sentences didn't make sense. So
She's a little nutty.
the next day, though, I had the use of my arm again, so that was
Oh,
kind of cool. I remember laying there and thinking, I can't move my arm, like this is crazy.
That quickly.
Yeah. So
Is
I was
that
really
normal?
lucky.
Is that normal, Lynn?
Not always. You don't
No?
always get that effect. In the original studies, when they looked at the drug, it was at 3 months where you saw the most benefit from the drug. So it does happen,
Yeah.
but it's not the usual. It's not like we call the Lazarus effect, where you give the drug and then all of a sudden everything's gone.
Yeah.
But
Well,
it
thank
can
God.
happen sooner than 3 months.
What were the other symptoms that you
lucky.
experienced? You apparently are.
I
based
had
upon
2
what we've
strokes
heard.
actually, and I don't know when they happen because they can't tell. They can just see the scar tissue, I guess, or the dead cells or whatever,
Yeah,
the
it'll
white
be-
matter.
Yes, ma'am.
There, and so it's funny because a few days earlier I was stuttering my words pretty bad, and I couldn't get a coherent thought out. And I wonder if that's what it was because it was a lot smaller than the other one. So
So
yeah,
you had
I
the
didn't.
first one and then the big one that caused you to have to go to the hospital.
Yes, and that was an immediate,
Yeah.
I knew exactly what was going on.
Yeah.
And then within that 24 hours, I was fine again. It was after I left the hospital that I started to have some issues, and still I'm having some to this day, which is unfortunate because it's almost like a silent issue because people don't, I look normal, right?
Right.
And so people don't know and they expect, and then they're like, oh, what's going on with her?
Yeah.
And
Yeah.
I'm like, I don't remember your name even though I've known you for 15 years.
Well, it's the
or-
same thing with mental health, you know. I mean, this is the last
Right.
great border of stigma to cross because you don't look like there's anything wrong with you. I always say if
Right.
somebody on crutches is going for a door, everybody runs ahead to open the door for them.
Right.
Yet if someone who has, something that's a little different, whether you've had a stroke, whether you have mental illness, whatever, sometimes people run because they don't know how to deal with it. I want to take a second here to talk about some of the folks who are with us today, and hopefully we're educating you and you can get some great information from this show about stroke. Brad Leedy, who works with me at Bridgehaven, is watching. James Green, Melanie Lane, wonderful lady. Michael Johnson is watching us, and Larry Schweitzer. Thanks for tuning in, you guys, to Take It From Tara. We had an hour with Barry Barker and Ferdinand, what was his last name? Whistler?
I missed that part.
It wasn't Whistler, and now his name has completely left me, but that's okay. He'll still love me tomorrow. We're at Union Station, which is TARC headquarters, and that's why I'm very, very glad that we were able to add on a second hour and talk to Ify Whitfill with the help of Lynn Hundley. Ify had a stroke, and Lynn is the stroke expert that was provided to us today by our friend Carrie Orman. We appreciate her. She's the executive director of the Kentucky Stroke Association. So I'm very, very glad that they were able to come in and talk to us a bit today, because my mother, unbeknownst to me, had a stroke when she was on her way to visit me last October. And they said it was from having atrial fibrillation. So I want to know more about this, and did you have it?
I did not, but that's what they were looking for.
AFib.
Yeah.
Talk to us about AFib and how we can tell, because they said you can be walking around with it and not have any idea that you have it.
Yes, symptom reporting is the least reliable way to know that someone has AFib. So you have 4 chambers in your heart. They're supposed to beat in harmony. The top 2 chambers, in AFib, the top 2 chambers kind of quiver. So A stands for atrial, F stands for fibrillation. So fibrillation is the quivering, atrial are the 2 chambers that are quivering up top. So you have stagnated blood flow here, which means there's blood clots can form.
Wow.
So they can come and go anywhere. They can go to either side because both chambers are quivering. But it is one of the worst types of stroke that carries the highest mortality and morbidity, because generally a clot will break loose and it lodges in what we call a large vessel. So if you think of the blood vessels that supply the brain like a tree, the trunk at the bottom is bigger and they get smaller and smaller and smaller as they go up. So if you clog up the big trunk down here, you're going to injure a large portion of brain. So they tend to carry a higher risk of death and disability.
Well, what was interesting is that she had taken a fall in the bathroom at my sister's house the morning before, and when she got off the plane, she was kind of tipped and kind of walking along the wall of the jetway, just leaning against it, and this woman was trying to help her, and she said, something's wrong. And I said, yeah, something's wrong. And I put her in a wheelchair immediately and took her straight to the doctor, and for some strange reason, nobody figured out that she had a stroke until it was too late. And so she had the AFib, she had a stroke, she began having aspiration pneumonia because she couldn't swallow, she had sepsis, and she died.
I'm so sorry.
All in the same,
it's very unfortunate.
Same 12 days. It is. And it's just like I keep thinking, I went back 3 times with her, and nobody figured out that she'd had a stroke until we were at the hospital. And then this fine raft of doctors said, yeah, this is what's happened. So what I want to know is, I actually saw what happened with her. She started to just jarble, like you couldn't make sense of anything she was saying. Just completely garbled, jumbled speech. And she looked scared. And I put my hands on her face and I said, Mother, what's the matter? Talk to me a little bit. And I had a feeling that was what was happening. Well, the doctor said, she's just got a UTI. It manifests itself the same way as a stroke in older people. So we end up getting antibiotics and going home. And the only person who would really listen to me, of all people, was my chiropractor. And all week he worked on her back and he worked on her legs, and he actually got her walking straight again. Gave her lots of love, gave her TENS unit and physical therapy, and just in Dr. Dana O'Neill, I will always love you for that. But it's so strange how these other doctors just would not check. I kept saying, can you not do some sort of brain scan, imaging, something to find out if she's had a stroke? And they just said, well, it doesn't matter because we'd treat her the same way if she has one as if she didn't have one.
Not if there's a clot.
None of that made any sense to me.
Well, that's a sad and unfortunate story, and I could probably talk for several more hours about the things like that tend to happen.
Yeah.
You remember I mentioned the stroke you had was 80% of strokes,
right?
Correct. And FAST is a popular mnemonic to teach people to remember. The other thing you have to remember is this sudden onset. You have to say that. Sudden onset. All of a sudden your mother couldn't talk.
Right.
So when you have a speech problem with stroke, there are different kinds of aphasia, which is the speech problem. Either you don't understand what people are saying to you, or you can't get your words out, or God forbid you have both and you have what we call global aphasia.
Oh.
Okay? So that's why she was scared, probably, I would guess.
Yeah.
Sudden onset of a speech problem. Sepsis usually creeps upon you from a UTI, and it's over time.
Yes.
It's the sudden onset people have to pay attention to. And to catch the other 20% of strokes that occur in the back part of your brain, because stroke is all about location, location, location.
Where was hers? Where was Ify's?
Where
In her
did you
head?
say, which side of your body was affected?
Left side.
So the stroke was
My
on the
right.
right side of her brain.
In the
In the
front.
middle. It was like right around here.
Yeah.
Yeah.
Okay.
Yeah, to
I
get her
remember
whole
the
side, it
scan.
had to be the right middle cerebral artery territory.
So
Yes.
why didn't you have trouble with, I mean, it
With speech?
didn't look like you lost everything.
Your speech center in 98% of the population is on the left side of your brain.
Okay.
I did have
It's
some
all
speech
about-
problems
yeah.
because
Did
my
you?
daughter said, "You sound
yeah,
funny."
you sound funny.
Yeah.
But
That was the
afterwards,
motor
it
speech.
doesn't sound
yeah,
like
after,
you.
no.
Yeah. Why did she
No.
get off really relatively
I
easy
know,
in
don't say
comparison
that.
to, well, and I'm not saying that there's anything minimalizing about it,
No, I
but as opposed to, I see people who have had strokes who can't speak for months.
Yeah.
Again, it's about location and time.
Okay.
Time to treatment. You got there relatively quickly. They got
Yeah,
your
thank God.
clot
I
buster
know.
drug on board in less than 60 minutes.
Yeah.
That is the key. You have to be treated early. You have to recognize those symptoms and call 911 and get to an emergency department at a stroke certified center that can treat you early. And again, those symptoms aren't always obvious. You know,
Right.
again, the face-arm speech picks up 80%.
Yes.
And with stroke being all about location, the back part of your brain where your balance and your vision are. Okay, so at Norton's, we've gotten on the bandwagon with BFAST. Okay, a health system called Intermountain in Utah came up with adding the B in front of it. The B stands for balance. So a sudden
Yeah.
onset of trouble with your balance,
Yep.
a sudden onset of visual changes in one or both eyes, and then the face, and then arm, add leg to that, okay?
Yeah.
Because it's not just your arm always. If you have had a large stroke, your arm and your leg are going to be
Yeah.
affected. Then your speech problems, trouble understanding speech or getting your speech out. Note the time, and it's time to call 911. I mean, you have to do those things. If you do not get in fast, then you're going to have a large stroke. Now, even sometimes, stroke is a bad disease. Even when they come in fast and get treated, the outcome is not always great. It just depends
Yeah.
on how well your circulation is, what we call collateral. So the older you get, the more rerouting you can do of blood flow.
Right.
So younger people often have worse outcomes just for the fact that they haven't had time to reroute that circulation, you know, by the time and wear and tear that you have on your arteries, like if you've heard of carotid stenosis and things like
Absolutely.
that. So your brain is very adept at rerouting blood flow, and unfortunately younger people don't have time to do
Not have
that.
practice.
So
Yeah.
you may not make, even though you get there fast and we get the treatment on board,
Yeah.
we can't always stop it. Does that make sense?
It does. We're in Union Station because we interviewed Barry Barker and Ferdinand, whose last name I can't remember, God love him, from TARC earlier, and now we're talking with Ify Whitfill and Lynn Hundley. They're a stroke survivor and a stroke expert. And the reason we brought this all up is because May actually was Stroke Awareness Month,
yeah.
which is pretty cool. So what we've discovered is that Ify had a stroke at 33 years of age 2 years ago. She got immediate attention, fortunately for her. She was administered a clot-busting drug, which helped to, I guess, minimize the other damaging effects of the stroke. But I want to know what the lasting effects were, Ify, because you told me that you did not have the opportunity or the time or chose not to go to a lot of physical therapy.
They actually didn't recommend physical therapy for me
Really?
when I left because I could walk and I could do all the different things that they had me do. There's a series of tests they have you go through.
Okay.
And so they said I was fine. But what happened was, and I think it's normal, you get the neurological pain. I just had pain in my arm, pain in my legs and my knees, tripping upstairs, things like that really don't hinder me from the day-to-day of just walking. But, you know, for me it was difficult because I didn't understand why. And I'd be like, oh yeah, you had a stroke and you can't be hard on yourself. And, you know, even though they cleared me to go home, there was that side of everything.
So what is that all about? What is this pain that she's talking about?
Sometimes after a stroke, you do experience some neuropathic kinds of pain. It may stay with you, it may go away. It depends again on what parts of your brain were affected exactly.
Yeah.
So there is an area of your brain that actually one of the classic symptoms of having a stroke in that area will cause you to have some pain.
Now you said neuropathic. Is that the same thing like when you have pain in your feet from diabetes? Is that neuropathic pain?
Sort of. It's kind of the same thing.
Yeah. Okay, cool.
They told me it was like the same as cancer, what cancer patients might feel with chemo maybe, or maybe not. Did I make that up?
I haven't ever explained it that way, but
Okay.
that doesn't mean it's wrong.
Yeah, I mean, seriously, because what we're talking about here is a 33-year-old woman who had a stroke and survived to tell the story with no very visible side effects or remnants of the stroke. So had you seriously considered going back to the doctor and saying, look, I'm tripping, I'm falling, I'm doing these things, and what can you do to help me? Or did you just figure I'm just going to have to get through this?
Well, so I had monthly checkups, and so I did explain that to him. But recently I've been training for a race that I wanted to do. And
what kind of race? Driving a bus? What kind of race?
So I'm doing a race. I'm running a 4x100. I was an athlete in college, so
Obviously.
my friend called me and she said, "Do you want to do this relay with me?"
Cool.
And I was terrified, of course, because I haven't run in like 15 years. But I thought, I'm going to do it. It'll be great, and I'll get to see if I can actually do it. And so I started training hardcore for it, doing like CrossFit and other things like I'm used to doing. And my husband, the first day I ran, just to show him, I was like, let me see if I can take off fast, He's like, you're dragging your leg. And I'm like, no, I'm not, because I didn't feel it, or my brain didn't, I didn't feel like my leg was lower, basically. So I've been training for like 2 months now, and all of a sudden, my right leg is starting to get sore, and I'm like, why is it so hard to run? And then I'm like, I'm dragging my left leg. All this time I've been dragging my left leg, and I just realized it because I don't know, it's like a disconnect between what I think is happening and what actually is physically happening. So I had to look down and see that, oh yeah, it's not getting as high as the other one.
So is this a typical side effect of a stroke then?
When you treat the stroke, we can't stop all damage. There's going to be some, and that's what you're dealing with now. Mm-hmm. Not obvious things that often will bypass the need for acute rehab in the hospital.
Yeah.
I would recommend you talk to your physician about some outpatient therapy that could possibly help you. Oftentimes, someone that doesn't have an obvious physical deficit falls through the cracks.
Yes.
So I know you talked about remembering things and having some issues with remembering what you want to say and things like that. You still have a brain injury.
Right.
You still have stroke in your brain. So if you think about the wiring. If the message doesn't get from the switch to the light, it's not going to come on. It's the same concept. So some speech therapy might benefit you as well.
Yeah.
But that does happen. After a stroke, even though it looks like you did really well, there is still injury to your brain, and it still messes up the circuitry.
So would speech therapy work for, since I had a depression, I've had what I call word find issues, and I don't know if that's actually a technical term, but it's like I struggle to find a word. And for somebody, who's had a lifetime of performance experience and public speaking and then being in the media, it's one of the most frustrating things ever. And I can only imagine what the level of frustration for you has been dealing with 3 kids and a husband and, running a business. But is that something that speech therapy would also help with?
It can, if that tends to be one of her problems, absolutely.
Yeah, well, I'm thinking about it for me.
I
See if I can help myself find words again.
I hate to tell you, but if you're my age,
don't say it's old age. Don't even think about it. Don't even go there.
It's that timing of the hormonal things that go along with that, unfortunately.
I think it has a lot to do with it.
I wonder if that's me too. I mean, I know I'm still in my 30s,
you're 35
but
years
I have a
old.
lot of friends who are in their 30s that say they forget a lot too. But I'm like, it's not the same, because it's in the middle of a sentence. I knew 5 seconds ago what I was going to say, and all of a sudden I have no idea.
Well, did you ever see the Ellen DeGeneres stand-up where she says, have you ever forgotten what you're going to say as you're saying it?
Right. Literally all the time.
She says, so then you revert to things like, well, 6 and 7, or whatever she comes up with, some silly, well, you can teach a man to fish.
Right.
But the reason that we're talking today to Ify Whitfill and Lynn Hundley is because it was National Stroke Awareness Month last month, and we were trying to get together before today, but today was the first day we could actually sit down. Ify Whitfill had a stroke 2 years ago at the age of 33. Lynn Hundley is on the board of the Kentucky Stroke Association and an expert on stroke at Norton. Lifetime as a nurse and an advanced practitioner in the area of stroke. So I think what I would like to know from you, Lynn, is, first of all, how many people are you seeing every day who are coming into Norton with strokes?
Well, my role currently is as a director, so I don't see patients.
Okay.
However, our I've got 4 hospitals under my purview, and last year we discharged over 1,400 patients with a stroke diagnosis of some sort between our 4 hospitals.
Wow.
For the entire year.
100 a month? Wow.
Depends on which facility.
2 a day, 3 a day?
Yeah.
Wow.
3 a day?
Yeah, I mean,
That's
and
so
the numbers
scary.
aren't spread out evenly across my 4 facilities. Of course, Brownsboro, my comprehensive center, has the most. And then Audubon, probably a second downtown, the Norton Hospital downtown, and then Women's and Children's probably has the least amount. But yeah, I mean, it's a lot.
That's unbelievable, actually.
Well,
and are you seeing a lot of younger people who are having them now?
We have noticed our numbers trend down. I mean, if you look at, you would think that still the most strokes happen at 85 and older, but the number of younger people are going up. And when I say younger, I mean less than 65, in their 30s and their 20s. Those numbers are creeping up.
Wow.
Oh, sorry.
I was just going to thank James Banzer, another wonderful newsman who's watching, Brick Marlin, great musician, Ed Jutt, Anita Boland. Thank you guys so much for tuning in to Take It From Tara. Ify Whitfill and Lynn Hundley, let me just reintroduce them to you. I interrupted you.
I was just going to say that when I was checked in, there was a girl a week before me. I think she was 13.
Oh my God.
Who was in there? They told me, and because I said, do a lot of the young people come in here? And then actually, one of my friends, her son, I think he was 5. He had a stroke, and they didn't know. And for 2 weeks, she was going to the doctor and saying something's wrong, and they didn't know. And he ended up passing away because they didn't treat him for a stroke. They just kept sending him home. And she said, I really think you should do a CAT scan or do something. They didn't. They similar to what happened with your mom.
Sounds like what I said. Yep.
And for him, and I want to tell the story because there's so many young people who are even under the age of 30 who are having issues, and people don't know. They think they're drunk because they're stumbling,
or they do a drug test.
They do drug tests, and so, or a child his age, his eyes, when it happened, his eyes, I think one went one way and one stayed straight or something.
Oh,
but
wow.
is that a common thing that happens sometimes with stroke?
It depends on the location, but that sounds like a brainstem issue.
Okay, so that happened, and that was one of the things that she said she wished that she had told the doctor maybe, or that had been known, or that she knew a little bit more about it so that she could have shared that. But she tries to go around and educate people. But I think it's important that people understand that it's not really restricted by age.
Not at all.
And I think for me it was energy drinks. I'm just going to say that. Hopefully you don't get in trouble because I'm not going to name the specific one. But I was drinking a lot of energy drinks, and I was staying up really late. I honestly felt like I was addicted. Well, I probably was, because I would just shake and I could feel my heart racing.
Okay, so Lynn is sitting over there nodding.
The heart racing causes the clots, right? Because it's similar, because,
There's lots of things I could tag on to for that. So stress, dehydration, the amount of energy drinks have been linked to bad outcomes.
Yeah.
You don't really want to drink that stuff.
Yeah, I don't
you
anymore.
have the PFO. Did you form a clot somewhere? Or
right.
did you put yourself in and out of AFib? That can happen. The AFib can come and go. And it may never come back again.
Right.
So you had lots of things working against you there.
Right.
That's pretty amazing.
So that was silly to drink the
sweater up.
Silly to drink the energy drinks on my part. I won't be doing that again.
Anything in moderation, right?
Yeah.
I mean, to have an energy drink or a soothing drink on a hot day, but to just be pouring them down your throat.
Right. I mean, I was drinking multiple cans a day.
Oh my!
Of the big can,
Yeah.
So.
Isn't that interesting? What else can cause stroke in our food and our beverages, the choices? Is there stuff that we should actually think about staying away from, Lynn?
Well, lately they're saying Diet Cokes can increase your risk of stroke. So
oh, wow.
That was really sad news for me.
You're a Diet Coke lover.
Not anymore, but yeah. So
diet drinks, something to watch out for.
The thing, and you're so on target when you say it's not age related. Anybody can have a stroke for any reason that's out there that causes a stroke. But the younger people that don't fall into that category of a coagulation disorder or a dissection or a PFO, probably our risk factors are awful these days. People have hypertension. So watching your diet is key. Prevention is key. We still have 800,000 strokes per year, so prevention is key. So when you ask, does having too much salt directly cause a stroke? No, but it causes hypertension.
Right.
And hypertension is the number one treatable risk factor for stroke.
Wow.
So you're watching your diet, the fats in your diet, your bad cholesterol, which we call LDL.
Right.
Watching those things. They say sitting is the new smoking. So I've now got a job that keeps me out on a desk too much. So I've got to work on that.
Yep.
Of smoking. Unfortunately, Kentucky still has some of the highest rates of smoking.
Yep.
Carotid disease and aneurysms
Yep.
are higher in Kentucky than they are in many places in the United States.
Yes.
Watching your physical stress, getting your physical, making sure you don't have that irregular heart rate. Do you have sleep apnea? Are you getting it treated? Are you limiting your alcohol intake?
Okay, let's go back. What about the sleep apnea? Because a lot of people, including yours truly, have sleep apnea.
So do I.
Okay, so what is the connection between sleep apnea and stroke?
It causes a lot of the things that cause stroke. So it can cause atrial fibrillation.
Okay.
It can cause heart failure, hypertension. It also causes thickening in the carotid arteries, which can cause stenosis, which can lead to stroke. If you think about it, during the night you're not breathing, your brain's not getting the oxygen that it needs. So that's not good for your brain, obviously.
Good Lord.
So it's not a good thing. And many people don't even realize they have it, or they can't tolerate wearing their masks, they just go without it, they don't go get treated, and so it's another big cause that's often overlooked.
That's just phenomenal. When you came out of the hospital, Ify, how long was it after you got home did you start to feel normal again?
I felt normal before I left the hospital.
Did
honestly.
you?
Yes. I was very lucky, apparently. Well, I've known that. Like, I was up and walking around. I remember I was sitting in the chair and the doctor walked in and she goes, "Okay, where's the patient?" And I was like, "It's me." And she was just kind of like, "Oh, okay,"
Really?
because I was just sitting on the chair, you know. I wasn't even in the bed or anything. So I was okay. I felt normal. It was after when I went back to work that I started to not feel normal, because I went back too soon because I felt normal, and I made mistakes because my brain didn't work the same anymore, and I didn't realize that. And I'm very competitive,
of course.
You know, so I was like, I can do this, and then I couldn't.
Yeah.
So it was after the fact that I started to realize that maybe I shouldn't have pushed myself so much, because I didn't have those immediate issues, and so I was like, oh, I'm fine. And even when it was happening, like I said, I was still working. I just think something must have been wrong in my brain where I didn't know what was happening, because I was like, why are they trying to give me a catheter? Why are they putting me on this table? Let me out. You know, I remember saying that to the doctors. Like, I just was not thinking straight. I was like, what is going on? Why do I have to stay here? And
I've heard
it's
people
like,
describe it as being trapped in their bodies and unable to communicate.
Well, I could talk, apparently.
Yeah, apparently you could.
And then I would wake up and be somewhere else, and I'm like, oh, okay. And it was like I didn't even realize that I was still there, but I did. I don't know how to explain it. It was a very strange experience.
Yeah, kind of out of body almost.
Yes.
Were you thinking? So, Lynn, when you have a stroke, the process of rehabilitation is dependent upon the location in your brain in which the stroke took place and the number of minutes that passed before you could get intervention. So in a case like my mother's, since nobody could figure out that she'd had a stroke, she didn't have the opportunity to have the intervention, which then led to the aspiration pneumonia, which then led to sepsis. So if you aren't, first of all, you said the stroke centers are very, very important. And there are accredited stroke centers at University of Louisville and Norton and any place else that we should know?
Actually, all of the hospitals in Louisville are certified as stroke centers at some level.
Oh, good.
So we're very fortunate. I mean, and to have 2 comprehensive stroke centers in one city is also very fortunate. You should go to the closest place that can give you the treatment that you need. So if you live closer to one hospital or the other, you should go to the one that you can get to the quickest, and so that can treat you.
So what's the process when we walk through the ED? It's no longer the ER, it's the ED.
Okay, well, first of all, you need to come on an ambulance.
Don't drive yourself.
Don't drive yourself, okay?
Oh,
literature will show you that if you come in on an ambulance, you get to that CAT scan faster.
Right.
So,
really?
Yes, ma'am. The ambulance comes in the back door.
Yeah.
They're waiting. They call ahead. I have
Yeah.
a patient in the ambulance that is having a stroke. They're waiting for you when you get there.
Wow.
Everybody's standing there. They're getting all the information they need to make a decision about your treatment. They may pop in an IV, draw some quick labs, and you're off to the scanner to get your brain scanned.
Again, like Grey's Anatomy.
Yes.
They're
Yes.
all out there in their little paper things.
Yes.
Yeah. Sorry.
It's okay.
Go ahead.
I like Grey's Anatomy too.
We have to have some fun.
totally
It's
out of
such
reality.
a serious topic. I
So,
know, but I
yes.
just love it.
I do
They
too.
just had
I
the
do.
plane crash. I watched it from the beginning.
Yes. me
Last
too.
night I was watching.
What plane
it.
crash?
You're binge watching.
The old
Did-
one,
I
the
am
older
binge watching.
episodes?
Yes.
Oh,
yes,
okay.
It's when
I
they
was
all
like,
got
what
in the plane
happened
crash.
again? Yeah.
And Christina kept saying, "I've lost my shoe."
Oh.
And Meredith kept saying, "Derek!"
Yeah.
And
Oh.
Arizona was losing her leg, and she just was screaming and screaming. And
Oh.
it was why was I watching that?
No, it's depressing.
I was up till 3 o'clock in the morning. Is there any wonder why? I was watching a plane crash on Grey's Anatomy. Anyway, so they meet you at the gate.
And they're ready. They know.
up.
They know exactly. It really is like a well-oiled machine. We've done much process improvement on our stroke processes, as I'm sure they have at the other centers in the city. Our goal is to get drug on board in less than 45 minutes. If we can get all the information that we need, we're not going to sacrifice safety for speed, but
Right.
if we can get all the information that we need, we're going to treat you as quickly as we can, which saves brain cells. Again, save a minute, save a day. For every 15 minutes we shave off from the time you have your stroke to the time you're treated, you literally get back a month of functional recovery. So it really is all about time and treatment. So we work as hard as we possibly can to get that patient treated as quickly as possible, whether they need clot buster medication or they need to go on to see our neurosurgeons to have a clot removed out of a vessel in their brain.
Have you had experience in your family and friends with stroke?
Fortunately, not my family. Colleagues, families of colleagues I have,
Yeah.
but fortunately not in my family.
So how different is it treating someone, I mean, in the profession that you're in, obviously, you have to be professional in every regard, but what is it like having someone you know coming into a comprehensive stroke center at Norton and you being the expert? How do you separate yourself?
It's hard. I actually had a friend that went to another place and was experiencing some of the same things that I don't believe this is what it is. It's very frustrating. And I'm an ICU nurse by training. I spent 15 years at the U of L Trauma Center as an ICU nurse before I moved on in my career. And that loss of control is absolutely unbearable.
Yeah.
But I mean, if I'm there to support my friend or my family, then the personal has to go out the window. And,
Right.
and I know, as hard as we have worked at our centers, that they're going to get the care that they need. So I can feel better about stepping out of the way and making
Well,
sure
and
that
they make
continues.
you get out of the way if you're related to the people. Again, Grey's Anatomy, get her out of here!
I hope they don't talk to you like that in my ERs. But
Get her out of here. Oh, poor woman, that scared her. It wasn't meant for you, ma'am.
hopefully they won't do that in my hospitals. But
So I want to
goodness.
welcome Brad
That's hilarious.
again. I'm sorry, it just was such a bad timing thing there.
Perfect timing, really.
Ed Judd and Anita
The comedy.
Bolin. I know. Well, you've got to have some fun, and even in a very serious conversation, and I think that's one of the reasons why animals are so important in therapy. I mean, I work at Bridgehaven Mental Health Services. We have 3 therapy mammals, and then we have the fish. So we've got Sawyer the dog, who's a golden doodle, who everybody adores, who's 2 years old. We've got the 2 cats, Harley and Quinn, and then we've got the aquarium. And it means so much. So I'm curious as to how much animal or pet therapy can figure into someone's recovery from stroke.
I think it's absolutely a wonderful thing. We actually have therapy dog at Audubon,
Do you?
and we allow the WAGs, I think is the service,
Yes,
and at
they're
all of the
fabulous.
hospitals. I love them.
Yeah.
I think they're fabulous. Anything that can get anybody motivated and lift their mood, make them feel better. Again, you work so hard, you were so driven. Not everybody's like that. Anything that can motivate that
Wow.
is important, and I'm all about that.
So what did you tell the kids?
About the stroke?
Yeah.
Well, they were there, so they saw.
All 3 of them were there.
Yes. And so they saw, my husband was there, thank goodness.
Oh, yeah.
And they had to go stay with family. And so they'll say things like, I don't want you to have a stroke again, or I don't want you to die, things
Yeah,
like that.
sure.
Or they just know that I had a stroke and that I was sick and things like that. So they were so young, because what were they, 3, 5, and 7 at the time.
Yeah, that is
So that's
young.
really young. So they didn't
Hard to
really
understand.
comprehend. They just knew mommy was in the hospital. And because I was talking to them and I was cognizant, they didn't know the seriousness of it, I suppose.
Yeah.
They don't really know, I guess, the effects of a stroke. Because when I came home, I put them to bed the night I got home, so they didn't really miss out a whole lot other than I was in the hospital for 5 days, the 5 days that I was gone, so. Yeah,
So
they were very lucky.
do they grade stroke like from 1 to 10 or A to B to C? I mean, how do they measure the intensity or the horribleness factor of a stroke?
There's a couple of ways. The horribleness factor or the severity of the stroke is measured with a scale that we call the National Institutes of Health Stroke Scale.
Okay.
It's a very structured exam that we do with rules. Do you remember them showing you pictures and having you read words off of cards and things like that while you were there? Do you remember any of that part?
I don't remember that.
So that scale you can score from 0 to about 42. It's like golf. 0 is good.
Yes.
42 is bad.
Oh, yeah.
Okay. So that's how we measure severity. That's, as a matter of fact, that's how we risk stratify the level of stroke severity we get at our hospitals. And then after you leave, there's a scale called the modified Rankin scale, which measures your level of disability. So 0 means you have no effect from your stroke. 1 is a little bit, and higher that number again, it goes to 6, and unfortunately 6 is a death. 5 is, dependent in a nursing home, unable to function. So for what you're telling me, I would say you might have a 1 on the modified Rankin, and that is a good outcome indicator. I mean, 0, 1, maybe 2, those are the good outcomes for modified Rankin. So we can measure how severe is the stroke with the NIH stroke scale, and then we measure how bad it affected your life with things like the modified Rankin. That's a pretty popular one in the research.
So I think this is important information to disseminate, because one of the worst feelings in the world is to have someone that you love lying in a hospital bed and not being able to get the resolution that you want, even if it's not possible, and not being able to get the information you want, or I think worse yet, not feeling like you're being heard. So what are some of the things that you guys did? I mean, you and your husband and your children were, in a pretty awful situation, 3 little tiny kids like that. Yeah. Your husband went to the hospital with you.
Yes.
And what were some of the things that he immediately asked for? What did he do to bring attention to what you were experiencing and get some immediate response and help?
So is it the triage room, or he wasn't allowed back there, of course. That's kind of where they were asking the questions and making everything happen, deciding what they were going to do. I think he was more of a bystander, honestly, like just kind of let them do what they need to do, and they've got it handled, just because everything was so quick also.
Yes.
And then once I had the TPA, and I honestly have never really asked him, like, what did you say, or did you say anything?
It's not exactly dinner conversation.
He's not educated in that arena. Like, if he was a doctor, maybe he could have said something, but he didn't really know. But my aunt, who I grew up with, actually, she is a doctor, and she was asking me all these questions. Did you do this? Did they do that? And, tell them to do this. And I'm like, I just regurgitated whatever she told me to tell them, because I didn't know.
Yeah.
And then when she got there, she did talk to them and make sure, obviously like any mother would, talk to them and find out what they were doing and make sure that they were doing it right. So
what can a family member do in a situation like Ify's, where they've brought someone in with a stroke? What can they do to hopefully direct the doctors in the correct diagnosis? I mean, what can a family say?
Well, a family or a witness. So someone that can say, this is the last time you were normal. Your kids witnessed your stroke happen. It doesn't always work that way.
Yeah.
Like, say you were at home and you went to bed and you were fine, and then you woke up with those symptoms. We need to know the last known normal so we can figure out if we can treat you or not. Right. So knowing that, knowing the medical history, knowing the medications that you're on, and if you can't write in with EMS, provide a cell phone number. We teach this to EMS as well. They need to be able to get a hold of, what if you couldn't speak? What if the stroke had been on the left side of your brain and you couldn't provide any of that information? We need to be able to get a hold of someone that can give us that so we can make determinations about your treatment. So absolutely being well versed in what's wrong, and don't give them a phone number at your house where they're not going to get anybody and you're driving to the hospital. Make sure that you've left a cell phone number where someone can get a hold of you, because that can delay treatment.
Yeah.
We can't treat you if we don't know your history. There's medications out there that you might be taking that we can't give you TPA. And then we would need to work you up for the advanced intervention, where they go in and take the clot out. Or maybe,
glad you didn't have to have that done, right?
Yeah. So that, knowing the information and getting to the hospital, making sure we can get a hold of you, and providing that history is important, especially if you go to a hospital where you don't have a chart.
Yes, brand new.
Yeah, and they don't know anything about you.
Okay, so let's talk about now what's happening 2 years post-stroke. Side effects linger?
Yeah, with the
leg dragging
and the memory. I don't notice my mouth as much. That was sad for me, because at the time I was heavily into doing live videos, doing makeup and stuff, and so I noticed, but nobody else did. But when I smiled, my left side wouldn't be as high up, or taking pictures, and that was just sad to me. That I don't know. It reminded me that I had a stroke, because I did kind of get away from dealing with it, I guess. But then I always had this reminder that I'm not normal anymore. And
well, what's normal? It's a setting on your washing machine. Seriously, there is no normal.
Never heard that before.
I'm convinced.
Okay.
Sheila Bishop is watching us. Michelle James, thanks for tuning in. Brian Gatewood. A lot of people are interested in this topic, Ify, and what I'm curious about is your life has changed inextricably since the stroke, but you have managed to persevere. and you've gone on, and talk to us a little bit about your business. Go ahead, gratuitous self-promotion time.
Oh, okay. Here we go. So I run a marketing agency. I just started, like I said, was it 6 months ago?
That's awesome.
And yeah, it was a big leap for me because I've always wanted to do my own business, but being young, I kind of discounted myself. Like, oh, you need to learn more, you're not there yet, or it's going to be too difficult. And so I actually lost my job last summer, and that's when I decided to kind of take the leap and do this on my own. So what we do at Red Eye Marketing is we do digital media mainly, but all kinds of marketing services from SEO, search engine optimization, to social media optimization, web
Which means
design.
that when you go on, you're going to look yourself up, you're going to be high up in the list.
Right, exactly. So people can find you, right? Design services, but just everything. Everybody does everything. But where we really add value is the strategic part. So instead of just saying, I want this, when you come to Red Eye Marketing, we look at what you're doing, we look at what you should be doing, and then kind of make recommendations to you based on that, based on your goals. So not just, well, give me a logo. It's like, well, do you actually need a logo that does this? Or what is your logo saying about you? And is it the right messaging? And so we try to think about what we're doing for our clients rather than just, giving you what you think you want when you really should get what you need.
And how did you get into this line of work, Ify?
So I started out at a small company here locally in Louisville called rentalhouses.com, owned by Rob Massey. He's a property manager here. And I was doing advertising sales, and I was traveling to like New York and Philadelphia were my main markets, and I loved it. Yes, I got to stay in some nice places. But anyway, so I did that, and doing advertising sales is what I did. I had to also market myself and then market my services to people to buy the ads, right?
Sure.
So I realized that I had an affinity for marketing, and I studied psychology, and then I got an MBA.
Yep.
So I knew the business setting of it, and I understood, how people think and why they think the way they do and why they do what they do. I then moved from there to another small company called The Learning House here in Louisville, and I was a marketing coordinator, and that's kind of where it really took off for me. I learned a lot about SEO, search engine optimization, and search engine marketing, pay-per-click. That's when it was all getting really big and people were getting into it, and so I just became an expert there and went to U of L after that. So yeah, I got kind of in the trenches and learned on the job. So
search engine optimization is very important for me because when you type in to Google, take it from Tara or Tara Bassett, I need to be higher up on the chain than the porn star Tara Bassett in New York.
Oh, no.
A very important distinction. I am not the porn star, I promise you. Yeah, so we got to work on that.
All exposure is good exposure, though, right? Well, maybe not. Maybe not in this case. It doesn't work the same way. Oh, yeah.
That was
it's
funny,
a pun.
Ify. So is Ify your given name?
No, it's Ifunanya.
Oh, I like that.
Pretty. Thank you.
Oh, that's
Thank
beautiful.
You.
Is that a family name?
No, actually, it just means love. It's kind of a common name in Nigeria.
Ifunanya.
That's where my family's from.
So were you born in the United States?
No, I was born in Athens.
Because you have a beautiful accent. In
You
Athens,
can hear
Greece.
it?
Oh, yeah. I picked it up the first time I met you. So why were they in Greece?
School. So yeah, I'm actually British, though.
Well, see, I kind of was going to ask you that, too. You sounded like the words that you spoke were like a little Londonish, but...
Yeah, I'm from London.
Okay, cool. Well, see, London. She says it even like she's like Meghan Markle or something, She's an American.
She's American.
I know, but she's trying to be British.
Okay. She's got to try a bit harder then, doesn't she?
Tries a bit harder.
No, I think she's mastered that.
We're talking to two lovely women. Lynn Hundley is an expert on stroke as a nurse and as an advanced practitioner and as a member of the board of the Kentucky Stroke Association. And Ify Whitfill, who had a stroke herself, who's in marketing and does an amazing job. She's 35 and the stroke took place 2 years ago, so there's no age limit on stroke, and there's no demographic. There's no. We always say this with mental illness too. When I work at Bridgehaven, we say it doesn't matter what your sexual orientation is. It doesn't matter what your race, your gender, your religious preference, your political affiliation, your age, or anything else, because these things are non-discriminatory. And to have a stroke at an early age, to me, would be devastating because my mother was 97. And she was in excellent health. World War II veteran, never let anything get in her way, charged ahead through life, always took very good care of herself. And that's why it was such a surprise to me when they said she'd had a stroke. So you can be asymptomatic, I guess, for a very long period of time, and then all of a sudden it's just like, boom.
And that's why the sudden onset is so important. Usually that's how it happens. All the stroke symptoms, the sudden onset, and that's why we try to make sure we drive that point home. Unfortunately, people don't recognize and try to, as with your mother, unfortunately, they didn't recognize what was going on with her right away, even though you describe her speech difficulty as a sudden onset episode.
And then it went away. That was the scariest part. It was like it happened and then it was gone.
Yeah. And I mean, there are things called transient ischemic attacks. Some people call them mini strokes and pin strokes, but I really hate those terms. You either had a stroke or you didn't.
Yes.
Right.
So in a transient ischemic attack means that you had the symptoms, they went away, and when I took pictures of your brain, I could not see a stroke in there.
Wow.
That by definition is a transient ischemic attack or a TIA.
Oh, I've heard of those in my stroke groups, and I never knew what they were.
That's what they are, and that is a red flag warning. If you started having those things, you need to be going to the emergency department to get the stroke workup. The same things that cause the TIAs will eventually cause a stroke.
So you just said stroke group.
Yes.
Support groups after having a stroke?
Yes.
Talk to me about that.
I didn't get any support from anybody else around me because they don't understand.
Right.
So it was a Facebook group. It's the just the stroke group. I can't remember the name of it, but it's an international group. And there's thousands of people in there. But I went in there and I said I just had a stroke last week or something, and then it's just helpful to have people who understand. And here's what I'm going through, because not to vilify my husband, but when I got home, because I was so normal, he went back to work, and I felt like he should have hung out with me for a couple of months or a week or something at least, so that I could, I don't know, acclimate and then just feel his presence
used
there.
To it again.
And I honestly, I felt sorry for myself. I did, because I was like, I almost died, and I had to deal with that fact that it can happen again. I didn't know why at the time, and I guess I just wanted to wallow in self-pity, which I don't take a lot of time to myself, and I just needed that little bit of time to recover.
I think you're entitled to a little self-pity after having had a stroke.
I agree.
Not so much when you break a nail, but having a stroke is okay. So just
I felt like I couldn't though, because there was nobody to really talk to, and I was just on my own and dealing with this. So
just Googling stroke support groups. You can go to stroke.org, the National Stroke Association, Kentucky Stroke Association, which is a big one. They're all there's just
we have a young.
I just joined.
Did you join the young person support group?
I did.
That's
ours. Probably a year after though.
Brittany is the leader. Have you come?
No.
It's at Meets at Mark's Feed Store.
Okay, I haven't gone to any actual meetings
yet. So we actually have a physical stroke survivor support group for younger stroke survivors.
Oh, good.
As practitioners, sometimes we're a little late to the game, realizing we're not fulfilling a need.
Yeah.
And it's been recognized, since there are so many more younger stroke survivors, their needs are different. As you said, you're trying to go back to work, you're trying to take care of family.
Right.
Yeah.
Whereas someone that's older maybe has retired and doesn't worry about those things, and their needs and support that they need are different. So we started this young stroke survivor support group a couple of years ago. Stroke nurse navigator Brittany Wannemuller runs that group. So I'm sure Tara can give you contact information for me if you're interested.
Yes,
I know they'd be happy to have you.
Yeah, definitely.
So even though you're 2 years out, your experience and your storytelling, I'm sure would be a great value to the other members.
Absolutely. And she's wonderful at storytelling.
Yes.
I love that. That's part of being in an agency too.
Yes.
Storytelling about your
That
business
helps.
is one of the most important parts of marketing yourself. So when we started out today here at beautiful Union Station in downtown Louisville, this is TARC headquarters, and we tormented Barry Barker and Ferdinand. Hey guys, what is Ferdinand's last name? It's driving me crazy. He's like the number 2 guy in this whole building.
George.
No, not George. It's like you're the number 2 guy. Oh, George is the number 2. Come here, George. Come on over here, George. I think it's Rishko. It sounded like Whistler. Rishko. I was right. Ha! That's right.
There you go.
That just came out of nowhere, too,
There you
right?
go, Rishko.
Sorry.
Did he really? That poor man. He's probably leaving because I couldn't remember his last name. Ferdinand Rishko and Barry Barker spent an hour with us talking about the need for great drivers at TARC, and also the environmentally friendly aspects of taking the bus as opposed to using our cars and contaminating the already horribly contaminated Ohio Valley. So that was a great conversation. And this last hour, we've been talking with Lynn Hundley and Ify Whitfill. Ify had a stroke at 33. Lynn is a stroke expert who is on the board of the Kentucky Stroke Association, as well as a fabulous practitioner at Norton, and that's a comprehensive stroke center. And I'm just so glad that you went to U of L, now that we know that U of L and Norton are the 2 comprehensive stroke centers. and got what you got very quickly so that you didn't have long-lasting effects. Now, the next question is, and don't let me freak you out when I ask you this question, does having a stroke incline you to having another stroke?
Yes, absolutely. Having a stroke puts you ready for another one. So their job while you were there was to find out what caused your stroke.
Yeah.
And unfortunately, they said cryptogenic. You do have the PFO, but I guess they didn't land on they were sure that's what the cause was. Right. So whatever we do for you while you're with us is called secondary prevention. So if we can find the cause, then we can put you on secondary prevention. If it was a buildup of plaque in your carotid artery, we can do the surgery maybe and do an endarterectomy. If you have atrial fibrillation, we'll put you on one of those blood thinning medications you see on TV all the time. You know how they want to up their game and all that stuff on TV. Yeah, so you need to be on an anticoagulant. It may be possible that the best thing we can do for you is help you manage your risk factors and put you on an aspirin every day.
Yeah, I'm on
no
aspirin.
energy drinks.
And
I'm
no
on
energy
aspirin
drinks,
every
no
day.
Diet Coke.
Oh, that's good.
Yeah.
Is
And I
having an
actually
aspirin?
I had a loop recorder. I'm sure you know what that is.
Yes, I do.
What is it?
So I had an implant put in for about 6 months. I kept mine in. You can keep it in up to 3 years, but they didn't find anything in 6 months, and I think that was enough data for them to move forward and say that it was cryptogenic. But it's basically this little, I guess it's not a microchip, but I don't know. It reads your heartbeat.
Wow, how interesting.
And I had to wear one for a while with just pads, and for 30 days, and then they did the implant because they didn't find anything with the pads. So
do you still have it?
no, I took it out last April.
It
But I
can
have my
stay in
son.
for 3 years.
Yeah.
It's got a 3-year life battery.
So the things that Ify is doing right now to take care of herself, she's exercising. She's going to train to be a triathlete here, whatever. You're going to do some sort of
I don't
horrible
drink or
thing.
smoke.
You
and
don't drink or
haven't-
smoke?
Yeah, no.
And your diet is good.
Sometimes I eat a lot of cake after 7.
That's okay.
Like a lot.
That's okay. Obviously, you are not overweight.
Right.
Oh, yeah.
That's a very big help. What
Yes.
other things that can Ify do to reduce her chances of having a second stroke?
Well, as I mentioned, hypertension is the #1 manageable risk factor,
Yeah.
and you're African American, so
Yeah.
you are
And I
risk
had
for you have
gestational
a
diabetes.
you
so
have a
that
higher
doesn't
risk for the
help.
hypertension just because of your genetics. So watching your blood pressure, keeping an eye on it. I always make fun and say when you go to the grocery store, make sure you stop and check your blood pressure before they total up your groceries, not after.
That's so true.
Just because you're taking your medication, if you're on blood pressure medication, doesn't mean it works. So watch your blood pressure and work with your doctor to manage that. And you're already doing a lot of the right things and listening to your body. When you get really tired or fatigued, you will notice that those stroke
Yes.
deficits that you had before will start to show themselves.
Rear their
Yes.
heads.
Yes, they will. If
Well-
you get an infection or you get sick, you might notice that as well. So
Yeah.
I tend to not sleep a lot because I like to stay up and do things that I shouldn't be doing, like watching television or working.
Yeah, I was binge watching Grey's Anatomy till 4 o'clock this
try not to
morning.
watch
It's
TV,
terrible.
yeah, getting
But-
a good night's sleep is
Huge.
really important.
I know, and I
With
hate
everything
water,
you've
so
got
that
going
doesn't
on.
help me. So I know those, and I sit a lot, so I try to, when I remember, like to get up and walk, or especially if you drink water, which you're supposed to drink water, then
Yes.
you get up because you have to get up and go to the restroom, so that it kind of like
Then you can
it
walk.
works itself out, right? So
It does.
I try to say, okay, just drink this big thing of water so that I can get up and
You can
Yeah.
put a
move
flavor
around.
packet in
and-
it.
No energy drinks.
That's true.
No energy
No
drinks.
energy drinks.
I don't like water either, so I buy those flavor packets to put in my water because
Everybody does
especially
that
if you're
now.
training and working out, you really need to
Yep.
stay hydrated. That's really
I know,
important.
yeah.
Ladies, thank you so much for being with us today. I appreciate you.
Thank
It
you
was
for having
wonderful.
us.
Ify Whitfill, who is the stroke survivor, and Lynn Hundley, who is the person who is able to tell us everything about how she had it, what happened while she was having it, how she was recovering from it, and how she can avoid having another one. Lynn Hundley from Norton, and thank you both so much. It was really
Oh,
an
my
informative
pleasure.
hour. I appreciate it.
pleasure.
It's good
Thank
to see
you.
you again too, my
Me
dear.
too.
And to meet you.
Yes,
We'll
absolutely.
do this again. It's so much fun. I have to
Yes.
actually get up and walk over here and turn off my mic.
my
But
God.
first,
Okay.
Mary McKenna Reshka and Glenda Adkins, great homeless advocate in Louisville. Thanks for tuning in to Take It from Tara. And on Wednesday, I will have Raptor Rehab for our Wagon Wednesday. So get ready to see some pretty impressive birds.